Today we're going to be demonstrating cryotherapy techniques. The first part for any cryotherapy application is sensory testing. Specifically, we will want to be testing hot and cold sensation. So the process of sensory testing is I'll explain to the patient that I'm either going to apply a warm sensation to their arm or a cold sensation. And to start the process, I would just ask them to close their eyes, and then I would apply either the hot or cold sensation. And their job is to tell me which sensation that they do feel with their eyes closed. And we're just going to demonstrate that process real quick. It is important to keep in mind the dermatomes when we are sensory testing. So I'm going to apply right here.
Hot. Cold. Hot. Cold.
And that is an example of sensory testing for cryotherapy application.
Hello. Before we do any cryotherapy modality, we have to be aware of some precautions. These are universal precautions. The first one is hypertension, thermoregulatory disorders, superficial peripheral nerve, open wound, poor sensation, poor cognition, very young and very old ages, aversion to cold, and intense exercise after cold.
To list the universal contraindications for cryotherapy, we have cold urticaria, cold intolerance, proximal cold hemoglobinuria, followed by chiroglobinemia, Raynaud's disease, a regenerating peripheral nerve, circulatory compromise, and finally peripheral vascular disease. Those are our contraindications and precautions for cryotherapy. Firstly, to go over ice massage application, the typical cryotherapy benefits are evident in ice massage as well as the other cryotherapy modalities. Just to list some of the benefits, we have decreased inflammation, decreased nerve conduction velocity, which will lead to a decrease in pain. And there are also other benefits such as decreased muscle guarding and spasm and decreased tissue metabolic activity. Uniquely to ice massage, the main benefit is an acute injury at a bony prominence or distal joint is a situation where we would want to use ice massage over other modalities. For the application technique of ice massage, we will want to have a Dixie cup, and then we will kind of sort of tear the top aspect of the cup and then just kind of peel around. And then from there, we will have a more smooth application of the ice on the patient. And our example for an ice massage case is lateral epicondylitis, which is more of a smaller bony prominence where we can apply the ice massage. And some parameters include you don't want to apply an ice massage to an area larger than about 10 to 15 centimeters. And additionally, the ice massage should only last about 5 to 10 minutes, and the skin temperature should not drop below 15 degrees Celsius. And that about wraps up the parameters for ice massage. The patient will feel the full or cold sensations during the application, which include cold, burn, ache, and then finally numbness. To apply the ice massage, we will want to place the ice right on that area of discomfort, the lateral epicondyle, and we're just gonna kind of move in a continuous motion right over the area of discomfort. And as I previously said, we only want the treatment area to be about 10 to 15 centimeters. And I'll just continuously apply the ice for about 5 to 10 minutes, and that concludes the technique for an ice massage.
Hello. Today we are talking about ice packs. So ice packs are great for reducing acute pain and acute inflammation. And they're great like 24 hours post knee surgery. Some parameters for ice packs are it's great to use them for 20 minutes twice a day, or you could do 2 cycles of 10 minutes with 10 minutes off, which shows to be more effective, and there's a decreased risk of tissue damage. If someone is inactive, say post-surgery, 24 hours total knee, you want to repeat applications of 30 minutes every 2 hours. And the flexible gel packs, so for example, something that looks like this, they typically will reach a temperature of negative 17 degrees Celsius and anything less than 30 degrees Fahrenheit a towel is recommended. Hello, today we have a patient here with a right shin acute injury. So you can see that we have elevated his injury site. Now, like I said previously, our ice pack that is below 30 degrees Fahrenheit is wrapped in a towel. And now we're just gonna place it on the injury site, just like this. Compress the injury site without hurting the patient, and you are all set.
Next up, to go over another method of reducing edema as well as pain and acute swelling is the contrast bath. The contrast bath kind of acts as a vascular pumping mechanism as you are alternating between vasoconstriction with cold water and vasodilation with warm water. The parameters include about 4 minutes of warm water and then alternating to 1 minute of cold water. There's some alteration, but that is the main parameters from the literature. And you want to perform that 4-to-1 ratio of 4 minutes hot to 1 minute cold for about 4 to 5 cycles. And that will induce the effects of decreased pain, decreased swelling, and a decrease of edema in distal extremities, such as the hand or the foot. And as previously mentioned, the vascular pumping is what induces these benefits.
Some contraindications are any contraindication for heat, cold, or water. And then some specific ones is small vessel vascular disease due to diabetes, arteriosclerotic endarteritis, or Buerger's disease.
To go over the technique for a contrast bath, as previously mentioned, we are going to want to have a ratio of about 4 minutes of hot water to about 1 minute of cold water, and then we're going to perform 4 to 5 cycles of that for about a total of 20 to 25 minutes. The temperature for the warm water for maximal therapeutic effects would be 100 degrees Fahrenheit to 111 degrees Fahrenheit, while the cold water temperature should be 50 degrees Fahrenheit to 64 degrees Fahrenheit for maximal cooling and maximal heating effects. So to provide a small demonstration of that, I'm going to ask the patient with some peripheral acute edema or a peripheral acute swelling in her left hand to place her left hand into the warm contrast bath. And she's gonna sit in that position for 4 to 5 minutes. And then we'll say that time has passed just for time purposes. Then after that, she's gonna slowly raise her hand out of the warm water bath and then transfer it directly into the cold bath. And that is how we're gonna get that vascular pumping mechanism to reduce pain, edema, and swelling. And then we're going to perform 4 to 5 cycles of that, and that concludes the technique for a contrast bath.
Hello, our final modality today is an ice bath. So we previously mentioned the contraindications and the indications for cold water therapy. Once again, it is good for reducing swelling and inflammation and acute pain. And the temperatures for a cold water bath should vary from 50 degrees to 64.4 degrees Fahrenheit. The lower the temperature of the water, there will be a shorter duration of time spent in the water. Today, our patient Robbie has right hand acute pain and inflammation. So what we're gonna have Robbie do is place his hand in the bucket of cold water. We already have measured it, and it is a good temperature from 50 to 64.4, and Robbie should feel the 4 stages of cold: burning, aching, and numbness. And he will just keep his hand in there until he feels all 4 stages.